I'm Tony Preston. You can find my content on integrativeworks.com. You can support this content and get exclusive content at Patreon, Integrative Works. Today's presentation is about trapezius. In general, trapezius is a broad, flat muscle in the upper back. It's superficial, and the shape that it creates gives it its name. Trapezius is part of extrinsic back muscles. Extrinsic back muscles connect the axial skeleton to the upper extremity, mostly the scapula. They consist of levator scapula, rhomboid minor, rhomboid major, latissimus dorsi, and trapezius. These muscles primarily retract the scapula, but they also are involved in elevating, depressing, and rotating the scapula. Let's look more closely at trapezius. Trapezius has an unusual innervation. Its motor supply comes from the spinal accessory nerve. The spinal accessory nerve is technically a cranial nerve as it exits the jugular foramen. However, it has nerve roots that run inside the dural sleeve to as low as C6. Trapezius gets its sensory feed from the ventral rami of C3 and C4. It's easy to see that upper cervical work is important when treating the trapezius. The base of the cranium is also important. Let's look a little closer at the structure of the muscle. Here is a posterior view, an anterior view, and a lateral view. Trapezius originates on the medial third of the superior nuchal line, the ligamentum nuchae, and the spinous processes of C7 through T12. It inserts on the spine of the scapula, the acromion of the scapula, and on the lateral third of the clavicle. In general, it retracts the scapula. It also helps in some upward rotation and stabilization of the scapula. Let's look a little closer at each individual section. Upper trapezius, which may also be known as cervical trapezius or clavicular trapezius, has long fibers that come off the clavicle. Although some references only refer to the upper trapezius as the fibers that run from the clavicle to the occiput, there are many fibers that connect the lower cervical area of the ligamentum nuchae to the clavicle. So from a bodywork perspective, upper trapezius originates on the medial third of the superior nuchal line and along the ligamentum nuchae down to about C5. It inserts on the lateral third of the clavicle. Because the majority of these fibers are more lateral than vertical in their position, upper trapezius doesn't really lift the clavicle. It actually pivots the clavicle on the sternoclavicular joint. This upwardly rotates the scapula. The upper trapezius also laterally flexes the neck when the shoulder is stabilized and helps to extend the head on the neck. Middle trapezius picks up where upper trapezius leaves off. Its origin runs from the ligamentum nuchae at about C5 to the spinous process of C7 and down to the spinous process of T3. It inserts onto the upper ridge of the scapular spine and the acromion of the scapula. Functionally, it primarily retracts the scapula. It also helps in upward rotation. Lower trapezius originates from the spinous processes of T4 through T12. It inserts at the root of the spine of the scapula. Its function is argued. It certainly is in a position where it would seem to depress or help to upwardly rotate the scapula. However, electromyographical studies show that it primarily stabilizes the scapula when the upper extremity is moved anteriorly. Let's look at one other function of trapezius. Trapezius and other extrinsic back muscles are involved in labored breathing. So let's take a look at this from an anterior view. We can see that trapezius and levator scapula and rhomboids support the scapula so that it can be elevated or at least resist depression. Then, from the front of the scapula, the deep extrinsic pectoral muscles attach. This includes serratus anterior, pec minor, and subclavius. Once the scapula is elevated or stabilized, those muscles can then expand the rib cage. This can cause people to experience trigger point referral from the trapezius during heavy exercise. The site has many posts on trapezius. It has posts on sensory functions, it has posts on trigger point patterns, self-care, therapy notes, and more. I've listed a few here. For the upper trapezius, there are therapy notes, and there are trigger point patterns. This classic temporal headache, which many people have quoted as the most common trigger point in the body, which is really a shoulder problem. As well, there's a trigger point that's especially important to people with sensory dysfunction that creates tension in the upper neck when they wear a heavy coat. It also bothers people who carry a bag on that shoulder or might have someone sit on their shoulder. Middle trapezius also has therapy notes. And another trigger point that affects people with sensory dysfunction. This trigger point near the root of the scapula in the middle trapezius creates burning and an irritation with tags. It also produces irritation in the sympathetic ganglion, which increases the fight or flight response. Middle trapezius also has a trigger point that creates pain just on top of the shoulder when you carry something on the shoulder, like a strap from a bag. Lower trapezius, again, has a trigger point that irritates people with sensory dysfunction. This trigger point, also near the root of the scapula, produces that sort of itching burning that makes you want to rub your shoulder on a door frame. As well, there's a trigger point about midway along the lower trapezius that creates broad overall shoulder pain that has a focus of pain in the upper neck and out on the tip of the shoulder. This shoulder is particularly bothersome for people who sit and lean their elbows on a table and close their chest in order to stretch that upper back. There's more. If you want to see all of the posts related to trapezius, go to the trapezius anatomy post on Integrative Works. If you're on YouTube or Patreon or my site, please like and subscribe, and we'd love to have your comments. We'd love to make this work better for everybody. I'm Tony Preston. Thanks for your time.